Hey, once again, I've discovered I'm common. MarkBradley's with us from Brantford Podiatry. Welcome back.
Thank you. Lovely to be back again.
And I'm common because this foot here, suffering through plantar fasciitis, which I went and looked up on the internet. And thanks for the information, because you're going to give us some information on it.
Yeah, and that, the most important thing is most people either don't take the time or don't take the time to, really dissect what the information is. What the plantar fascia is a very tough fibrous band that runs along the bottom of the foot. And it's kind of our last reserve, our last stabilizing structure. Normally the muscles that wrap around the ankle are what control is and stabilizes. When they can't do their job, this is what we rely on. So it's kind of a little bit like the parking brake in your car. And you're driving with your parking brake all the time on there, and eventually it'll fail. So when it gets inflamed, it gets stretched, and it's not elastic. So when it gets stretched, it tears where it attaches to the bone, and that inflammation is what causes your pain.
Well, the first thing in terms of what I went through in symptomology is one of the first things I went through is felt like my ankle was unstable. And nobody has explained the ankle part of it as you just did right there.
Yeah, and again, those muscles that stabilize the ankle are exceptionally good at what they do, but when they start to lose their mechanical advantage, and there's a whole host of things that can lead to that, and that's the most important thing. No matter who you go to get to treat this, they've got to diagnose where it comes from. Sometimes it can be an acute thing. I might get somebody in today that spent the weekend hanging Christmas lights, standing on a stepladder, and just stretched the fascia for so long that it caused it. Or it can be somebody that comes back and goes, yeah, I had this before and it went away, and then it came back and it's even worse this time. There's a mechanical cause behind that.
So is a possibility in some case that I caused this damage, thought it went away or just hurt for a couple of days, but really I had you call it a mechanical problem?
Yeah, it's like a chronic overuse problem.
And the weirdest thing is, well, I guess I'm feeling the pain in the heel. You're telling me the problem is the entire base of the foot, really? Yeah,
the fascia spans right the way along. Sometimes it can get very painful right the way through the arch. In fact, you can get a little fibrous nodules developing. But the most important thing is to treat the mechanical cause before you get into treating the symptoms. And the symptoms are the actual swelling and the pain. And there's numerous ways to treat the symptoms. You can have massaging, you can have cortisone injections, you can take oral anti-inflammatories, and that's a little bit like bailing the boat while we still have a hole in the bottom and the water's coming in. It's a bit pointless.
And Mark, we didn't get into one thing that you mentioned the last time you were here. This wonderful mechanism, the human foot, was never intended to have shoes on.
No. Well, again, it was intended for a totally different purpose, for climbing. Our toes used to be much more dexterous. They could hold things. We've lost a lot of that ability. Not all of us want to return to it, especially with the temperature going down outside. But again, it's totally changed, and we've changed the environment. And the heel pain situation, that's one of those things where one of the biggest groups I get will be someone that's retired 6 months ago. And instead of wearing the good stable footwear they wore during their working years, they're now on a pair of slippers or those nice moccasins they got for Christmas last year. And suddenly they're crippled.
How do you find that one magic bullet, that one cause then?
First of all, by listening. That's the most important thing, is listen to the patients. Let them describe their daily routine, their activities, their habits, what's changed. Did their weight change? Did their habits change? They just got brand new hardwood floors put in the house. It's not that caused it, it's just a compounding issue. So it'll be a mechanical dysfunction within their body combined with either footwear or their environment or their body, and together they come together to cause the pain.
Well, you're talking about the fact that, I guess, if somebody's feeling that kind of pain, whether it's in the heel, whether it's in the the arch of the foot, I guess the first thing is ask the question. So how does somebody find you? Where are you located here in Brantford?
Oh, we're right across from the hospital here in Brantford. Literally, if you stand outside the hospital door, we're right there.
So don't assume I'm just getting older. There is literally that fascia is the problem.
It's got a really unfortunate habit of getting worse. I mean, it's painful because the muscles aren't controlling you well enough. So as they continue their dysfunction, it'll get worse, and it can be really, really debilitating.
Mark, come back and see us and let's talk some more, but thanks for this today.
Love to. Thank you.
MarkBradley, Brantford Podiatry. We're coming back in just a sec, and we're going to talk dog and politics, maybe together on Inside Brant.